Hello. Thank you very much for this wonderful opportunity for me to be able to share and talk about the interface of mental health and planetary health. I will begin by discussing the fundamentals of this new powerful concept of planetary health, and then I will proceed with its implications on mental health. Of course, we have to acknowledge the current times where we are in today. And of course, everyone is probably afraid and concerned about the first wave, the second wave, the third wave of COVID. But of course, we also should remember that we are confronting other crises of ecological nature. And yes, we might be afraid of these waves, but we should also be afraid and concerned about the future tsunamis of health consequences that will be brought about by climate change, biodiversity collapse, and the broader planetary crisis that we're facing. We now live in what we call the epoch of the Anthropocene. And as you can glean from the term, right now we live in this era where the biggest force that is shaping the face of the earth is not anymore a natural phenomenon, but it's the myriad human activities that then inflict ecological damage to Mother Earth. So that's what you can see here, anthropogenic change. And I will not belabor you with the details of this diagram, but as you can see, our consumption patterns, the demographic shifts that we have, migration, continuous population growth, urbanization, and technological advancement, all of these contribute to the environmental changes that we see right now. And in turn, these ecological changes will then afflict impacts on human health on a planetary scale. And as you can see on the right, every disease group will be affected by these environmental changes that are human-induced. And so as a physician, I see myself as treating not just one, but two patients in the 21st century. On the left, you will see a young kid wearing a face mask, protecting herself from SARS-CoV-2. And on the other hand, you will see Mother Earth herself wearing a face mask, trying to protect herself not from the unseen coronavirus, but from the ecological damages that I mentioned to you before that are induced, driven by our human activities. And that is why in recent years, there has been a call, and a loud one, to reorient the field of public health, of medicine, and the broader health sector, and to reorient towards a much broader view, a much broader concept, which we now call planetary health. And as I've said a while ago, in the planetary health era, we now have not just one, but two patients, both people and planet. And in planetary health, we really talk about basically everything. We can't just talk about the health of human populations, but we also need to talk about the health of other living creatures that inhabit the planet, animals, plants, the microbes. But we also need to look at the different abiotic or non-living components of this planet. Basically, it's air, water, and soil. And of course, we also need to understand the social systems that drive these ecological changes, our political systems, our food production systems, the way we build our cities, urbanization, in the role of industry, our energy systems, so on and so forth. And another way by which planetary health is currently being framed or understood is that it really is the grand convergence of many disciplines and frameworks and paradigms that we are already familiar with. It's the confluence of medicine and conservation and climate change and climate science and earth sciences, ecology, public health, global health, international health, but also the social sciences. As I've said a while ago, we need to understand the human systems that drive planetary health challenges. It's also important to understand that while this concept sounds, new, novel, innovative, this understanding that the health of people and the health of the planet are inextricably intertwined is not a novel invention. You know, we go back to indigenous communities, ancient wisdom, and for centuries, if not millennia, these communities have already understood and acknowledged the deep interconnection between people and planet. As you can see in this quote, according to Chief Seattle, the earth does not belong to man, man belongs to earth. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. So this diagram, this framework that I want to share with you is one way to evaluate or assess the health or the current health of our planet. This is the Planetary Boundaries Framework, which was developed by the Stockholm Resilience Center in Sweden. And as you can see in this diagram, there are two boundaries. So these boundaries are quantitative boundaries that cannot be breached. Otherwise, if we breach them, if we violate them, it makes the planet less conducive for human survival. And here you will see 2 out of 9 already in red. That means 2 out of 9 already have been violated. One is biosphere integrity, because over the past century, we've seen the fastest rate of extinction of creatures great and small. And we know that biodiversity is important for our food systems, for the provision of natural medicines, for the stabilization of our ecosystems of the global climate. And then as you can see at the bottom, the other boundary that unfortunately has already been violated is the natural biogeochemical flows of P and N. What are P and N? Phosphorus and nitrogen, because we've been pumping our land, our soil, with artificial fertilizers containing these two elements, which then led to the massive disruption of this natural biogeochemical cycle. So 2 out of 9 already violated. 2 out of 9 are also soon to be violated. They're the ones in yellow, climate change. And we know that right now we are trying to keep the global average temperature increase below 1.5 degrees Celsius, because beyond that, a lot of the Pacific islands will already be erased from the face of the earth because of sea level rise. And the other planetary boundary that is about to be violated is land system change, because we've already basically humanized a great portion of our land for agricultural production. We've been building, casinos and new cities and subdivisions and golf courses. And we know that we need to preserve the naturalness of land so that our planet can thrive, not just in the years to come, but for centuries to come. So 2 out of 9 already violated, and 2 out of 9 soon to be violated. And this is the state of the planet today. And we in medicine, in psychiatry, in public health should be very concerned about the health of the planet. But it's also important that we do not just protect the planet's integrity, we are also able to meet the basic needs of humanity, not just for some, but for all. And so this British economist, Kate Raworth, came up with this new framework for revised and envisioned economy that will safeguard the future of the planet, but also ensure that the basic human needs of everybody are being met. And this is what we call now the donut economy. So the donut economy model is quite central in the planetary health field, in planetary health thinking. And as you can see, it looks like a donut. In fact, Kate told me that this donut perhaps is the healthiest of all donuts that are yet to be baked, because as you can see, this economy is not overshooting beyond the ecological ceiling, the planetary boundaries that I described to you a while ago, but also are not having shortfalls in the social foundation, because everybody has access to food, health, water, education, housing, gender equality, political voice, etc. So this donut is what has been described as a safe and just space for humanity. And I would recommend this book. I think it's very powerful. And I always say it should be a must read for every planetary health citizen and planetary health physician in the 21st century. And there's actually a study done by the University of Leeds in the United Kingdom. They tried to answer the question among the countries in the world, which one is closest to becoming a donut economy. And as you can see, just by eyeballing, it's not the US, it's not the Netherlands. They might have achieved the basic social foundation for their own citizens, but they violated almost every planetary boundary, a lot of reds outside the donut. Unfortunately, the Philippines, while we have not violated any of the planetary boundaries, as you can see inside, there are a lot of reds because we still have lots of shortfalls when it comes to the social foundation. People are hungry, people do not have access to education, people have no access to healthcare, so on and so forth. And according to this study, the country that is closest to becoming a donut economy is a country that is 3 hours away by flight from the Philippines, and that is our neighboring Vietnam. As you can see, not so many reds outside, but also almost have achieved the basic social foundations because of very little red in the inner part of the donut. So maybe the question that we should all be asking is, in the era of planetary health, how can we all be like Vietnam? So now I'll shift gears, and we've talked about Planetary Health 101, the basic fundamentals, the basic foundations. Now we will proceed with discussing a more specific issue, which is climate change. And as you remember, climate change is one of the 9 planetary boundaries. But unfortunately, according to the latest report of the United Nations Intergovernmental Panel on Climate Change, every region in the world is already experiencing climate extremes, whether it's too hot or too wet. And of course, all of these phenomena have grave implications for agriculture, for livelihood, and most especially for human health. And this diagram is from The Lancet, as you know, a world-renowned medical journal. And climate change is going to affect human health in many different ways. You can see there are multiple pathways, multiple arrows here, whether it's through storms or drought or flooding or heat waves. And as you can see also on the right, climate change will be affecting every disease group that we are familiar with. There's no single disease group that is going to be immune to the effects of climate change. As you can see, under nutrition, we're expecting 50 years worth of gains in nutrition to be reversed if climate change will not be stopped. We are also expecting more infectious diseases, dengue, malaria, and other climate-sensitive vector-borne diseases to increase in number, but also to spread in different parts of the world. As you can see also, cardiovascular disease and respiratory disease, especially when you're exposed to extreme heat, that can lead to heat stroke and other chronic illnesses. And of course, there's a growing evidence and recognition of the intersection between climate change and mental health. And shortly, I'll be talking about that in greater detail. But it's also important to understand that the health impacts of climate change are going to be unfairly distributed. So as you can see here at the top map, you will see the parts of the world that have emitted the greatest amount of greenhouse gases into the atmosphere: North America, Europe, and much more recently, China. And at the bottom, you will see that the countries that are magnified are the ones that will be bearing the brunt, that will suffer the health consequences of climate change. That is Africa, that is huge parts of Asia. And unfortunately, the Pacific Islands are too small to be magnified in this map, or probably, again, as I've said a while ago, they probably would have been erased from the face of the earth because of the rising sea levels. And here, this is the map of Southeast Asia. And in this map, the redder the country is, the more vulnerable the country is to climate change. And unfortunately, our beloved Philippines is the reddest of them all. And it just speaks to the increased vulnerability of the country, of our country, to climate change and its myriad health effects. And of course, during this era of COVID-19, we've seen the confluence between climate change and pandemics. Filipinos, especially the poor and the vulnerable and the marginalized, have had to confront this dilemma. On one hand, do I stay in the house to protect myself from COVID, but perhaps my house will get inundated by intense flooding, or the roof might be blown away by the strong wind. On the other hand, do I move to these cramped evacuation centers to be safe from disaster, from storms? But as you can see here, there's no social distancing to begin with, and there's a very high risk that you will contract the unseen coronavirus. And of course, it's not just the disasters, the abrupt and the catastrophic events that are going to be happening. They're already happening here in the Philippines, but also the slow onset effects. And one of which I mentioned about it already repeatedly, sea level rise. And Philippines, being an archipelagic country, is going to experience the fastest rate of sea level rise in the world, 5 times that of the global average. And so we should be starting to be concerned about our coastal communities. A lot of our poor Filipinos living in the coastlines, relying on the sea for their livelihood, and seeing their houses being, swallowed by the sea because of sea level rise. So now let's talk about mental health. And as I've said a while ago, this is a growing science. Among the different disease conditions that are linked to climate change, this is perhaps, the newest one in terms of research and policy and practice. So this diagram is actually coming from a report that was published by Climate Cares. It's a global initiative based at Imperial College London. I sit in its advisory board. And as you can see in this diagram, there are at least 2 main pathways that link climate change to mental health. One is through the extreme weather events. There's a disaster, people get affected immediately, and they, acquire, post-traumatic stress and other forms of psychological sequelae. On the other hand, and this is the other pathway, which I already alluded to a while ago, people also experience the slow onset effects of climate change. Sea level rise, their houses get inundated, their croplands get destroyed, extreme drought limits the ability of the farmer to produce, food to harvest. And these will definitely also impact the mental health and the feeling of security of many people in the Philippines and around the world. And so this is the slow onset, delayed, and long-term pathway that links climate change with mental health. And you might have heard of these newer terms and concepts that have emerged over the past several years: ecological anxiety or climate anxiety, ecological grief or climate grief, solastalgia. So this is a growing science, and as you can see, there are several papers that have already been published over the past several years on these new concepts in psychology and psychiatry, particularly environmental psychology. And I want you to pay attention to the one in the middle, which is a very new global survey that was conducted, published in the Lancet. And what they found out is among the 10 countries that have been surveyed, these are all young people from 16 to 24. And what they found out is that among these 10 countries, it's the Filipino young people who are feeling the most worried and the most anxious about climate change. It could probably be because of our live experiences, the typhoons and the flooding that these young people are already experiencing. And of course, what they're seeing in the media, but also the climate education that they are receiving in school. So around 90% are worried, and around 50% are extremely worried about the climate, according to this study. So, COVID-19 showed to us the weaknesses of our health system. Our healthcare system now is in a state of shock. Our health systems are not ready for the pandemic, or any pandemic for that matter, or even for climate change. And we can replace the healthcare there with mental health. Our mental health systems perhaps are also in a state of shock and are also not yet ready for the pandemic and also for future climate change. And so the question that we should be asking is, are we ready to build health systems that consider the climate? And are we ready to build mental health systems that consider the climate, that consider planetary health? And so these are just some of the initiatives that are already happening. And I hope that our community can participate in advancing these actions. So one is we need to start building climate smart health systems. Climate smart is the convergence between sustainability and resilience. Sustainability, we do not want to do harm to the planet. We want to make sure that we reduce our emissions, our ecological footprint. And on the other hand, resilience, the ability to bend without breaking, to adapt and respond to the health consequences that climate change will be bringing. And we need to do both. And in the recently concluded climate change conference in Glasgow, Scotland, COP26, more than 50 countries made a commitment to become climate smart health systems. Unfortunately, the Philippines is not yet part of it. And I think that mental health is actually at this nexus of sustainability and resilience. We need to find, ways to incorporate mental health into the building and the redesigning of climate smart health systems. And in the 21st century, our health systems in the era of planetary health should not just be climate smart, they should also be universal, they should be of high value, and they should be pandemic resistant. Universal, leaving no one behind. High value, people leave the healthcare system not just healthier, but happier. And pandemic resistant, because we know that in an era of a changing planet, we can expect more pandemics to come, unfortunately. And so we need to have health systems that are strong and resilient, can detect early these outbreaks, respond quickly, and lead us to a better recovery. And I think mental health is the missing piece in all these discussions about what kinds of health systems, future health systems, should we be establishing in the era of planetary health. And I hope that the psychiatric community will be pushing for this agenda. We also need to make sure that we promote nature-based solutions for mental health. We always just talk about the diseases, the mental health diseases and stress that climate change and other ecological crises are expected to bring about. But we also need to highlight the benefits of exposure to nature. There's actually a growing body of evidence about the mental health benefits of exposure to greenness, to parks, to trees, to urban forests, but also to blue environments. For example, in the UK, it's already becoming more, popular. This concept of green-blue prescribing. You prescribe, walking to the park or being exposed to the sea in order to be able to cope with mental and emotional stress. And we've been talking about the importance of adapting to climate change, being resilient, but we also need to advocate for mitigation. We need to fight for the continuous reduction of greenhouse gases emissions, and also to the lowering of the carbon footprint, the ecological footprint, not just of healthcare but of entire society. And that's why I think that decarbonization is mental health promotion on a planetary scale. If we prevent climate change from happening, if we prevent the breaching of the 1.5 degrees Celsius boundary or target that I mentioned to you a while ago, then that will be beneficial, not just for physical health, but also for mental health as well. So what are the things that we should be doing here in the Philippines? And I would love to invite you to take a look at this commentary that we published in The Lancet last year. It's an agenda for climate change and mental health in the Philippines. And we articulated some of the issues that I already described to you a while ago, the need for more research, and understanding how does eco-anxiety manifest in a Philippine setting or in a developing country setting? What are the interventions that are contextual that we can apply and implement so that we can build mental resilience amidst the changing climate? We are also soon about to roll out a study looking at the interaction between climate change and COVID and how it's impacting the mental health of young people. And so it's a 4-country study, plus in collaboration with Imperial College London in the UK, And if you're interested to collaborate, please let us know. And there's a lot of discussions now happening about this broader concept of planetary mental health. So it's not just about the mental health conditions and the situation and status of individuals and communities. We're now talking about the mental health of the entire planet. And so I invite you to this upcoming webinar organized by the Planetary Health Alliance and Harvard University. And there's also an increase now of commentaries and papers about, again, this concept of planetary mental health. We need to be talking about this also here in the Philippines as well. So we're all looking forward to the end of this pandemic. We all hope that we will be achieving what we call a post-COVID recovery. And we need to make sure that in this recovery process, we are able to build a green, healthy, and just future, a green and healthy, just world. And mental health, good planetary mental health, should be part of this recovery process. And also because, remember, I mentioned to you a while ago, the need for redesigning the economy. We need the economy, the donut economy that planetary health requires, because it's not just good for the planet. It's not just good for the material needs of people. It's good for the mental and emotional health and well-being of all peoples of the world. And so I invite all of you, our community, to embrace the planetary health concept. So I invite you to look at this commentary that we wrote in the Lancet last year. Basically, what we did is we, revised the Hippocratic Oath, the oath that we all recite before entering medical practice, into a new planetary health pledge for the era of the Anthropocene. We should do no harm to our patients, but we also should do no harm to our planet as well. I also invite you to join our growing community of planetary health advocates here in the Philippines. Planetary Health Philippines. You can Google planetaryhealth.ph. We need more people from the psychiatry and psychology fields to work with us. We're from different disciplines. We're interdisciplinary, intersectoral, international, and intergenerational, all working towards better planetary health and a robust and vibrant planetary health community here in the Philippines. I think that planetary health is planetary humility. It calls us to shift away from this ego-logical approach, looking at ourselves as being at the top of the pyramid of nature. We own nature, we can extract, consume, kill, mine, and instead, we need to shift towards a truly eco-logical approach, where we look at ourselves as being just a part of nature. Remember, according to Chief Seattle, we are part of the web. And we are able to live in harmony and in greater interdependence with all the creatures, great and small, and all the systems that constitute our living planet. And finally, I think that planetary health is a call for all of us to become good ancestors. This is another fantastic book that I would like to recommend to you all. And basically what this book is telling us is that in 2122, which is 100 years from now, the children, the Filipino children of 2122 will read the history books and will look back to the past, and they will say that the COVID generation of 2022, which is all of us in this conference, have been good ancestors to them, because we made the right decisions, not just for ourselves, but for their health and well-being as well. We owe it not just to ourselves, but we owe it to these children and to the future children of the Philippines and of the world, the children who are yet to come. So together, let's advance the health of people and planet. Thank you for this opportunity.